Hi there, I'm Dan. If you're here, you probably saw the title or someone told you about this. I hope to share information about COVID-19 that I've learned through looking at the data, looking at the analysis, doing some analysis myself. I'll share with you what I've learned and also where to get some of this data for your own self, because it is super important for us to be educated and especially important for us to make decisions that are informed, as in 6 days, this is October 28th, in 6 days we are electing the next president of the United States. So it is very important that we all in this time and even beyond the elections are informed about what is actually going on and armed with the data, which we now have. Back in March, we didn't have this, but we have it now. And we need to be armed with it and ready to discuss it with our peers and our neighbors and our family and share it with them that they may be informed. This isn't to push opinion on you or to create any kind of division. In fact, I hope to bring us together. I hope that this can tear down some walls of division, that this can really help bring people out of fear, knowing that there is data and we can wrestle with what we're hearing and what the data actually says. It's going to take a while. I'm going to divide this into 2 parts. I will talk about that later, so there'll be 2 videos. Get something to eat if you need it. This may be an hour and a half even. I got a scone right here from the local cafe near me, which, by the way, is still not allowing indoor seating. Breaks my heart. I love going there, but thank God their business is flourishing and thriving, just doing takeout. And get yourself a drink. You know, I got some beverages here with me. Life is Indonesia. I love it, right? I really love Indonesia. I have a heart for Indonesia. Hi, all my Indonesian friends. Yeah, selamat pagi or selamat malam, depending on what time of day it is for you. So let's get going. I'm going to first share my screen. This is going to be presented in PowerPoint. I'll leave the video off as a little caption on the side so you can see me if I'm talking directly to you. But I don't want to like bore you with a lot of data, but I needed a way to communicate this data to you that was consumable. I tried just walking people through Excel before, and that got a little boring, I think, to them. So I've tried to clip out what I can and put it in PowerPoint so that it's right there and we can get to it and discuss it and make it easy for you. So let me share that out now, and then we'll get going. And I'll get the video going here. I don't know why Zoom just suddenly started showing me all these little notifications. It wasn't doing that yesterday. I don't think it updated. Okay, give me one moment. Show video panel. There we go. Okay, so I'll try to move this little thing around, but if I minimize it, the video doesn't actually show up in the recording. Zoom feature request, please. Be able to like have video without having it shown while you're doing this. Okay, I have got to speak up. As I said, I've been looking at data around COVID formally for 4 months plus and informally since the start of this thing. And I can't stay silent. I don't want to stay silent, and I won't stay silent. There is truth that is just not getting out there. I believe love can be stubborn, and I say that in a good way, right? When love doesn't give up on you, love keeps persisting. Love doesn't change its mind about you and convict you, but says you're worthy, you're loved. I'm gonna bless you. I'm gonna love you until you receive it. That's kind of my philosophy. So You know, someone very, very dear to me gave me the nickname Stubborn Love. I am a US citizen. I'm loyal to God. I'm loyal to America. And I really believe in truth being told and getting out there. I don't think that's happening today. I will tell you that I follow Jesus. I love Jesus. I'm going to try to keep those beliefs out of this as much as I can today, because I want this to be consumable by everybody. I will make another video that will cover what I think Christians should be, people who follow Jesus should be thinking about, and a different perspective that we should be viewing this through. However, that said, I do, whether you believe in the spiritual at all or not, I do believe this is a spiritual thing. And so you'll hear me say some things about spiritual. I'm not going to push my beliefs on you, but I'm going to give you my opinion. And I'm not going to try to make you believe in Jesus. So don't worry. I couldn't anyways. Only God can do that. Is that, oh yeah. In terms of what my background is, I'm not a doctor. I don't have epidemiology degree or anything like that. I'm not an epidemiologist, health scientist, anything like that. I do have 2 degrees, 3, I guess, in the sciences though. An engineering degree, 2 engineering degrees, and degree, so that's in the computer sciences and molecular biology as well. So I think I understand data. I've got this, even though I don't have a degree in epidemiology and a doctorate. I can tell you though that you and I both, every one of us is capable of asking questions, and we should. We have a duty to. So I want to inspire you to ask questions. You don't need a degree to ask questions. You don't need a degree at all to look at data and say, I don't understand. The data looks like it says this. Why are they saying that? Or why am I not hearing it? We all should be able to do these things. And I want to empower you to be able to do that. Let's get going. When I get my slides moving. Come on now. All right, now I got to move this little bar thing again. Okay. So what I hope you get out of this is a new perspective. Hopefully this will help you. If you already know all this data, maybe it won't. Teach me something, you know, reach out, teach me something. But make sure there's data behind it that you can show me. And I want you to know that there is real verifiable data out there, and I want to show you where to get it. And I will deliver some of my analysis to you that I've done, as well as show you what real trained, like scientists who are paid to do this have delivered, including the CDC, and leave you with some questions to wrestle with for yourself, because that's what this is all about. It's about asking, am I getting the truth? Do I know what I should know so that I can make informed decisions and reach informed conclusions? Because every one of us has a responsibility to try to seek out the truth, and it's just not being made available to us. Why I'm doing this is that fear has been trying to destroy our country. I do believe there's a spiritual thing behind it, but whether you believe that or not, look around. Fear is trying to grip, right? It has been since March. People are still afraid to go out, and this isn't condemning anyone. My hope is to help you and be respectful, but people are afraid of this thing. They're afraid of dying. There's a lot of fear gripping the nation right now. And then you add to it, you got all these riots and all this other stuff trying to impress more fear upon us. I say, no, I'm not going to fear. I'm not going to fear. I encourage you not to fear, but I'm doing this because fear has been trying to destroy us. And I'm going to say, no, I'm going to do what I can. and share hope. I hope to bring you hope today. Good news, positive news. There's also been a lot of division among us. So people, oh, you shouldn't be wearing masks, or you should be wearing masks. I've heard some horrendous things said to one another, to people, just because of differences in belief on the mask issue, right? Let's love one another. Let's be respectful. Let's all look at this with the data, a data lens to make us informed, and then talk about our feelings and talk about our beliefs. Let's not condemn one another. Come on, that's wrong. But there's been great division, and one of the things we can do to try to break down that division is to bring truth. Okay, so it is also time, as I said, there's an election that is near. Now, this is not a partisan viewpoint. I am not aligned to any party. I don't align to Republicans, and I don't align to Democrats. Okay, I am registered as one of them, but I voted both of them in presidential elections because I look at where candidates stand on issues. I look at, I care more about what their beliefs are and how they're gonna wield the authority that they're given, and how that aligns with what I believe is right. You know, so I don't vote party lines, and this is not an attempt to exalt one party or one candidate over another. This is an attempt to say, we have truth, let's look at the truth, and then let's look at the world around us and say, who's saying what do we know is true and not. I will not tell you how to vote. You may be able to guess how I might vote going through this. I might tell you, I'm not sure yet. We'll see. I am going to raise questions and point out differences between the parties and their stances. What we're going to cover very briefly is part one, and there's going to be 2 videos because this will be just too long to be one video. Part one is going to be the data and media. So we're going to look at media, we're going to look at data. That's what you're watching right now. Part 2 is going to actually look at the presidential candidates, since the election is in 6 days, and what their stances are. I think in large part their stances carry over to party stances, but not always. I mean, you know, I think we have leaders, governors, even maybe on both sides of the spectrum, who depart a little bit from their party lines, from their party beliefs. So you have a duty to look at your own local candidates and leadership with this lens. I'm not going to do that for you. Let's get into part one. Okay, we're going to go into data and media. Before I do that, I want to show you this list of data sources. So you can screenshot this, you can screen capture this, you can come back to it later. I encourage you to take note of it. Just note that it's here. You can come back to the video another time if you need it. But these are places you can go get data. You just type in these URLs and you're going to go get data. Okay, so we're not going to go through every one of these things. This is just showing where I've gotten some of my data. We will go through a few of them because I want to teach you how to fish for yourself. I want to teach you how to get this data for yourself to the extent possible. I'm not going to teach you everything that I've done because I've taken data sources and used Excel to merge them together and do some analysis, and I don't expect you to do that. But there is some already done analysis out there, and I want to teach you how to get it, okay? Oops. All right, let's get into it. Headlines. What I want you to do now is put yourself in a frame of mind where you are letting go of distractions around you and you're listening. And watch if you want, read if you want, however you best absorb. Close your eyes and listen. I'm going to read headlines to you as they come up, and I want you to take note of how it stirs you inside. I might say how it makes you feel. I'm not sure if that's accurate, but what is the message that's coming across? How is it affecting you? Okay, this will take a minute or probably 2 minutes or so. So let's start going through this. Who will get the vaccine first? Here's where you might land in line. Iran struggles with COVID-19, US sanctions and collapsing economy. Chinese economy growing as the world still reels from COVID-19. More than 40% of coronavirus cases in US nursing homes are asymptomatic, new study. Nunavut, territory in North America, has no cases of COVID-19. COVID-19 vaccine unlikely before spring, warns chief scientific advisor. Nearly 2/3 of hospitalized COVID-19 patients still have lung damage. Tougher COVID-19 restrictions are once again the norm in Europe, CNN video. Panthers closing facility after unconfirmed positive COVID-19 test. Panthers' latest NFL team to shut down amid COVID-19 scare. World confirmed COVID-19 cases now top 40 million. Ontario's doctors speak as province recommends against trick-or-treating in COVID-19. South Africa's health minister gets COVID-19 as cases rise. Infectious disease expert, coming weeks will be darkest of COVID-19. As COVID-19 surges, so do Illinois teacher retirements. Number has jumped almost 50%. As COVID-19 roars back in Europe, government gets tougher on rule breakers. Once a world leader in controlling COVID-19, Czech Republic now tops in new cases per capita. Whales and other wildlife species could get COVID-19, potential cascading impacts. US clearly in a third wave of coronavirus infections as COVID-19 fatigue sets in. Europe's recovery uncertain amid COVID-19 second wave, says ECB chief. Lithuanians with COVID-19 self-isolating, vote in drive-ins. Expect a price jump in new COVID-19 rules when booking your next cruise. Trump calls Fauci a disaster and said it would be a bomb if he fired him. Trump and Republicans' healthcare plan would endanger people like me among COVID-19. Britain records another 18,804 COVID-19 cases and 80 deaths. Both Monday games on with no positive COVID-19 test for any team. First Lady of France, Brigitte Macron, isolating after contact with COVID-19 patient as COVID-19 cases spike in the UK. Wales locks down while Manchester resists. Ex-CDC Chief Frieden, COVID-19, protect vulnerable, let virus spread to the young. Why it's basically a bad idea, according to her. As the virus surges across the US, only 2 states are turning in the right direction. Consulting giant to shutter 4 offices as COVID-19 propels remote work. New US COVID-19 cases rise 13% last week to nearly 400,000. Sir Patrick Vallance warns COVID-19 will never go away. Okay. Process that. Think. How did hearing all that make you feel? I can tell you, if I put all that into my head all day, every day, I'd be miserable. I'd be miserable. Where is the good news in there? And I want to be honest, how I got this was, and this is just one day in October, sometime last week, I don't remember. I got an iPhone and I went into Apple News and I typed COVID-19 and I screenshotted all the results that came up. That's how I got this. I weeded out a few that were just completely irrelevant. They weren't positive, negative. They were just basically completely irrelevant. But that was only a few, a handful. I pulled out some that were possibly a little positive. We'll look at those next. But this was the majority of them. This is, I think it only goes out back like 8 hours or 9 hours or something. I mean, it's not even all of one day, but this is all the results that came out. So I've been listening to headlines. I've been seeing them come across my phone for like 9 months now, almost 8, 9 months. And I'm disgusted at the fear mongering. I'm disgusted at, it always seems to be bad news. It always seems to be spin. Why is that? Why is that? Well, I mean, I can't tell you for sure, but I'm going to postulate two things. One is marketing. What is marketing's goal? To get you to bite the hook. Right? When you and I go into these media outlets and read, or when we tune in on the TV or the cable channel, their viewership goes up, their readership goes up, and they make money. You know, they make money on ads when you watch, they make money on ads displayed when you read. It's about money. It's about controlling your mind, manipulating your mind to get you to read. Okay, that's what I think. It's marketing, right? I don't think I need to say anymore. You get it, right? They want you to hear it and say, oh, I have to go read that. Oh, and you know what? Fear has tended to do that very effectively over the past decades. You know, the folks running these organizations, teaching how to do it in academia, have learned it. You know, fear sells more than hope, probably. Okay, so if you and I go look at these things and everyone that comes out, not only are we feeding our heads with negative stuff and feeding our eyes and ears with negative stuff, but we're voting for it too, because we're giving them money, because we're tuning in and we're increasing their numbers rather than abandoning that media. So I rarely watch the news anymore. I rarely look at the news. I seek out when I need to seek out. I talk to people who do watch the news because it doesn't do anything good for me anymore, typically. Now, that said, there are some good news sources out there. You have to go find them. You have to seek them out. They're not mainstream. Okay. I'm not saying every mainstream news source is bad in every way, right? If you like your morning show, whatever. I'm saying be aware of what is coming at you and what you're putting in your mind, because if I were to fill my mind with this all day, I would be in a miserable state, and I'm just not going to do it. That said, let's be honest, there were a few positive things that came out in that search I did on the iPhone that day. So I believe in being balanced, right? That's fair. So let's look at some of those. Couple of 60 years reunites after 215 days apart due to COVID. That's awesome. New lab test clarifies the potential protective effects of COVID-19 antibodies. Awesome protective effects. Monday's NFL games going forward after second day of negative test. Woo! Football! Criteria to predict cytokine storm in COVID-19 patients identified. I think that's positive. Both Monday games on basically Monday games, football. Nunavut, a territory in North America, has no cases. More than 40% of COVID-19 cases in U.S. nursing homes are asymptomatic. So some of this is like encouraging news. Yeah, a couple gets reunited. That's awesome. There's football. Okay, I don't really care about football, but some people love football. So that's good news for them. Protective antibody effects. That's awesome. That's God created us with the immune system. Sorry, I'm going that route. We have immune systems. They're there for a reason, to do their job. You know, I hope that they'll do their job. I believe they'll do their job against this COVID thing. And antibodies are evidence of that. Now, that said, we have to be careful how we look at some of these also, because a couple of 60 years reunites after 215 days apart due to COVID-19. I have a choice as to how I hear that. Do I hear that as good news? Yay, they got together. Or do I say, wow, they were apart for 215 days. This COVID-19 thing is a monster. Oh, it's so big. Which am I gonna do? I have a choice as to how I think about that, right? So I can look at that headline and it can be either positive or negative. the way I read it. I don't know what the article says. I didn't go look, right? But keep in mind, like you know, we got to be aware of what we're thinking about, what we hear, so that we're discerning in the moment, because we cannot fill our heads with negative stuff all the time. We need hope. We need good news, and there is good news. This other one, well, let's do the nanovit thing first. I did look at that one. I did look at that article. Cool, but it turns out, I don't remember the details. Go look yourself. But turns out nanovit is like in the middle of nowhere, and you can't get in or out right now, I think. So without a resident card or something like that, you literally can't go in or out. So it's no wonder they have no COVID cases. It's tiny in the middle of nowhere and nobody's coming in and out. Is that really great news for America? I don't know, I'm just saying. More than 40% of COVID-19 cases in US nursing homes are asymptomatic. Again, this one could be looked at in positive or negative light. I think that's positive. I think that's great, because that means elderly, who are the most vulnerable population, as you will see, 40% of those folks aren't having any symptoms at all, according to whatever this study is, okay? That's great news. Like not even a cough, no symptoms. So let's just remember that my takeaway from this is media should have a role in informing us. But this is what we've been getting from media. And this is not giving us a balanced view and the truth. So you and I now have a choice of what we do. Do we go seek out the truth? Do we ditch media? I can tell you, I'm ditching media. I'm not going to listen to sources of media that are pushing fear. I will reward for good and I will not reward for bad. But you and I have a choice, and we are the ones to blame for it getting this far. Let's just make that clear. You and I, the American public, are the reasons that it got this far, because we accepted it. We bought into the fear. The things that sell in media: fear, greed, money, entitlement, sexuality, sex, you know, food, in a gluttony kind of way, right? These are the things that sell. I mean, let's just face it, right? That we've been buying into, we've been biting on, we've been making our bread, and we can't do it anymore. So if we keep doing it, it's just going to reinforce negative habits. So I encourage you, if you're like I was, looking at all this media saying, yeah, this stuff is awful, have the guts to cut the cord. Have the guts to not reward bad behavior. You don't have to get rid of cable if you don't want to. I did. You don't have to, but choose what you watch and choose carefully. All right, let's go into data, right? Like, thank God it's about time. Okay. So I want to share with you raw steps. I started tracking June 25th of 2020. And I started putting this together October 22nd of 2020. That's about 4 months between the two. It's 119 days. Again, my data, I think did I tell you earlier? I don't think I told you earlier. Let's go there now. Where do I get my data from? I don't think I mentioned that. If I did, well, sorry, I'm going to tell you twice. I get my data from worldometer here. And let me refresh this thing so you can see. It updates in fairly real time. It'll tell you the last update time there, and it's actually GMT, so it's ahead of our time. But it updates pretty regularly, and you might be thinking to yourself, well, what about CDC? How do I know this is accurate? Well, I've looked at it long enough that I know it's pretty close to CDC. In fact, worldometer is always seems to be ahead, higher numbers than CDC. So if anything, it's giving us a worse picture. Okay. I don't know why that is. I don't know if CDC filters out some stuff that worldometer doesn't, or CDC has a lag as to when data actually gets taken in and accepted. I don't know what the sources for worldometer are, but they track the same track and curves and track very close. And I'm going to show that to you. If CDC is working again now, we're going to go back there. So worldometer right now is saying 9.1 million cases in the US and 232,000, almost 233,000 deaths. Earlier, CDC's website was not working. I hope it's working now. Well, you know what? If it won't work, I can't do anything. Let's just try one more thing. Let's see. CDC COVID deaths as of today. Let's just try that. Nah, I'm in Oregon. No, that's not what United States cases. Okay, so here, this is probably, I'm guessing this is coming from CDC. I don't know. So you can just Google that now, right? I mean, I didn't even know you could do this. This is amazing. Like, and it'll come up with stats right here. Confirmed 8.93 million cases. So that's pretty close, like 9.1 versus 8.93. It's pretty close. So if CDC does have any lag, I mean, that would easily explain why they're a little bit behind, because deaths are going up by a lot, you know. I mean, confirmed cases are going up by a lot every day, right? Today, it's like up 88,000, according to this, almost 89,000. Deaths, CDC is saying 230,000. Well, this is saying 230,000 deaths. I don't think CDC is, yeah, that's about right. So remember, worldometer is 232,000, almost 233. So they're really close. This is almost 231,000. They're really close. So worldometer is good enough. That's all I'm trying to show you, but you can get your data wherever you want. I get it from worldometer because when I started doing it, there weren't good sources like worldometer. I mean, CDC, I don't remember being able to find any kind of download a spreadsheet, download stats. You had to manually type in all the numbers every day, and it wasn't broken down by state. Now CDC has better data, so you might be able to get the same data from CDC in a consumable format. But with worldometer, I could just like select this whole table and copy it into Excel. Got it? That's exactly why, oh, these are awful ads. That's exactly why I've been using worldometer, so that you know. All that to say, that's where I got this data that you're looking at here. So as of 10/22, 6 days ago, worldometer said 8,658,000 cases. Compare that to 2,500,000 June 25th. That means the case count has increased 246%. Said another way, in the 4 months that transpired, the case count more than tripled. It was like, take that case count and multiply by 3.46, because it started at 100%, right? And then you add 246% to it. So it more than tripled. Let's look at deaths. So 10/22 worldometer is saying deaths were 228,333. And June 25th, it was saying 126,780. Now that's a change of 80% increase. Said another way, you could say that deaths less than doubled over that same time. Deaths would be multiplying by 1.8. Okay. So you would take those initial 2.5 million cases, multiply by 3.46 to get to where we are today. For deaths, you would take those 126,000, almost 127,000 deaths, and multiply by 1.8. Now hear me. I'm not trying to devalue life in any way. Every life is important, and I don't want anyone to die. The fact is people are dying all over the world as we speak of other causes too, right? I don't want people to have to die of this COVID evil virus. That is not my point. I'm not trying to minimize deaths. What I'm trying to do is point out to you some real differences in what is coming across to us from media and what the statistics seem to actually say. Okay. If we look at deaths as a percentage of cases, I'm not going to go into the active cases, by the way, because really I don't think those numbers are actually accurate. I've watched them. Oregon hasn't updated their closed cases in a long time. I watched for months, stood it like they had like 4,000 closed cases the whole time or something. It was dumb. It was dumb. They were just increasing the case count. I don't know where it comes from. I assume it comes from the state some way, but Oregon's not been updating us where I live. So I'm not going to go into active cases, but if you look at the percentage of deaths by case count, so that means in October, take 228,000 divided by 8.6 million. So we're looking at deaths as a percentage of confirmed cases. That's important to know because later we're going to look at cases we didn't necessarily know about, we didn't confirm. But confirmed cases, that rate started at 5.1% in June. By then we were already doing more testing. So it was already going down because as we started to test more, it began going down. I don't know if we were at the same high test rate as we are now. It doesn't really matter, but the point is that the percentage of deaths to new cases has gone down dramatically. It's a 40% decrease from that 5.1% initially. So we take 5.1%, multiply by 0.6, and that's where we are today. You tracking with me? It's lots more data to get through. Hope this is not boring you. The last thing I want to point out is over on the right. Let me turn on the pointer so I can point here. So right over here, 65 and over deaths per 65 and over population. What I did is, again, this took multiple data sources to do, but I found out the population of each state and of America, 65 and over people. Estimated population. People are entering that category with birthdays and dying all the time, right? So it fluctuates, but as of, I think it was probably in 2018 numbers, the number of deaths labeled COVID or COVID-like in 65 and up age bracket this year, since this whole thing started, well, since June, went from 0.2% to 0.34%. What that is saying is that out of the entire population of people age 65 and older, 0.24% of them in June had passed away in a manner that was labeled to be COVID. So that would be about 1 in 400 people, 65 and older. That number is not going to go down because it's not a rate. That's just going to go up or stop. In October 22nd, that number had increased to 0.34. Okay, so from 0.24 to 0.34. And I would argue that is actually really good news. So 0.34 would be about 1 in every 300 people age 65 and up died with basically a COVID-19 diagnosis and maybe others on their death certificate. I think that's good news because in June, we had only been in this thing for what? Basically mid to late March is when it started to really ramp up. It was really April, late March and April. So if you look at late March, like that hadn't really even been 4 months. That was right around 4 months, and already the number was at 0.24, but it only went up another 0.10 in the next 4 months. You see what I'm saying? So the rate of deaths in that population has gone down, and we'll see that. All right, let's look at this same data, confirmed cases and deaths by number, but by raw number. So on the left here, this column tracks the total number of cases, which is listed in blue. On the right column labels, we see the total number of deaths. Now, if you see me like looking all over, I forgot to explain earlier, I've got this on a TV. That's why I'm like, it's behind the camera. That's why I'm looking all over, so sorry. Hopefully you're not looking at me, you're looking at the data. What do we see here? We see cases from June 25th to October 22nd with a pretty good and pretty steady, actually, slope of increase. So had a little bit of acceleration right there, but then came down, and it's been just steadily increasing pretty linearly since June. But if we look at deaths here, where they start at the same point here on different scales, right? But they start at the same point. The death rate has been much more flat. It has not increased with the same slope. Now, if the death rate had been as high as the new case rate, we would expect to see deaths somewhere up here. You know, not in the current 230,000-ish range, but in the well, let's say it started at 128, more in the 400 to 450,000 range is what we would expect. But they didn't increase at that same rate. And that's good news. That's good news. They leveled off. Well, we'll look at what they did in more detail later. Now let's take those same two metrics, deaths and cases, confirmed cases, and look at them as a rate of increase by percent increase, percent change. We start, of course, at 100%, and then so we increase 240%. So we start at 100, we go up to almost 350 on cases, right? And look at the left graph where my pointer is here. So on deaths, we start at 100% and we go up to about 180% in terms of the percentage of original deaths, right? The increase is 80% increase. Now, we see something here, and it almost looks like around August. I don't know if this is a thing or not, but what we see on the data is around August. It almost looks like an inflection point there, August 27th or so, somewhere in there. And it's almost like it starts flattening out a little bit more, and death starts trending, the slope of it starts becoming even less. Whereas the slope of the cases starts to become more. We see that even more pronounced if we overlay the two on a more even scale. So if I took 100% out of the scale on the right, which is the scale of the deaths, you can see, you know, the deaths starting here, which is 100% on the right column, going up to 80. You can see they kind of cross at that inflection point, but it's almost like the death curve is arcing and flattening, whereas the case curve is slowly increasing in slope. Okay, interesting. Hope you got it. If not, come back to the video and just pause it and look at it. I'm not going to spend a lot of time on this slide. This is straight from my spreadsheet. By the way, I'll flip over to my spreadsheet in a minute and show you so you know it's real. Not that you would care. But each of the data points that I tracked, and they were always 2 weeks. Sometimes they were like 1 week. Sometimes, you know, I would forget and be a little longer than 2 weeks. But roughly, I've got data points for about every month from June to October. Now you're not seeing October 22nd here because that's the total that I already showed you, and this is a comparison to that total. What we're seeing is for each of those data points, how much has the current number, in this case it was October 22nd, changed since that time. In terms of total cases, since September 25th, it was a 20% increase from September 25th to October 22nd. Again, if we go all the way back to June 25th, it was a 246% increase from June 25th to October 22nd. Deaths, the same thing. It was a 10% increase from November 25th to October 22nd, and an 80% increase from June 25th to October 22nd. The other thing to point out here is that the death rate as a total of cases, I tracked the percentage change in that. Remember, it went from like 5.1 to 2.6 or something like that on the previous slide we looked at. And you can see that it's down 8%. The death rate as a percentage of total cases has gone down in every single period since I started tracking this, and is down 48% since June 25th. That means like every period there's fewer and fewer deaths relative to the number of confirmed cases, is what this is saying. You can see that change. There's a rate positive here. That's not really a big thing, but the rate positive has been slightly declining in terms of if people are tested, what's the likelihood that they are, sorry, let me take care of something there. What's the likelihood that they are going to test positive if they are tested? That's what we're showing here, and that likelihood decreased 18% in 4 months. So not a huge decrease. The last thing here is that we looked at that 65 and up deaths as a percentage of the total 65 and up population. It's actually a mistake. I probably shouldn't say rate there. That's probably not a good name for it. But anyways, it's dividing the number of 65 and over deaths by the total population of 65 and over people in America. And we see that that increased 10% in the month from September 25th to October 22nd, and 80% since June 25th to October 22nd. So it is exactly the same rate of increase as the overall death rate increase number. That'll make a lot more sense when you see the data that breaks down deaths by statistics too. Tracking with me? I know this is a lot of data. We're about to get into a little bit more fun stuff, so stay with me here. As we're looking at this, we have to remember that the population density of America is not equal. So 50% of our population resides in the 11 largest states. Those are California, Texas, Florida, New York, Pennsylvania, Illinois, Ohio, Georgia, North Carolina, Michigan, and New Jersey. I mean, California's population is 33% larger than Texas's. It's almost twice the size of Florida and New York. And those are all big states. Pennsylvania, Illinois, Ohio, Georgia, North Carolina, those are all 10 million and up in each state. So the top 11 states contain, in terms of population, contain 50% of our population. 75% of our population resides in 20 states. So I'm pointing this out because we should probably expect that a state with a higher population might have a higher death count. I'm just saying. They got more people. They got more people to die. Just like, yeah, it's just a law of numbers there. Not to mention that a lot of those high population states are driven by high density areas. So, you know, look at Texas. I'm not that familiar with Houston, but you got Houston, Dallas, Austin, all pretty big, pretty good sized cities, right? Some of them really big. Chicago and Illinois, you know, Philly and Pennsylvania. You've got LA and San Francisco, and, you know, you got your California cities. Those are all dense, somewhat dense cities. New York City, super dense. Super dense. New Jersey, probably pretty dense as well. So we have to remember that we can't just look at these numbers and expect every state is going to be the same and it's being affected numerically by this virus. And there's a thing to be said for the role of density and all that. Okay, this is straight from my spreadsheet. I'm going to flip over to spreadsheet real quick and show you this is real. So here you go. So you can see this is my spreadsheet. I actually have these fields here. Some extra ones I'm not going to go into right now. We'll get into them later. But you know, this is straight from my spreadsheet. I'm going to move the little video thing here so you can see. I have ranked each of these states by the highest to lowest number of deaths recorded supposedly by COVID-19 cause. Okay, so they're ranked in order of deaths. Sounds kind of morbid, but hey, that's what everybody's afraid of, right? Is deaths. So let's rank them that way and see what we learn. What I also did is I cross-correlated I figured out through a data source how many 65 and older people are in each state. Okay, so I gave those a ranking too. It's pretty easy to do in Excel. So what you can see here is column A is just 1 to 50, you know, continuing on down at this smaller picture there. 1 to 50 of these states in order of decreasing number of deaths, not rate, number of deaths. Column B here is how that state would rank in terms of the number of 65 and over people in that state, the raw population of 65 and up. You can see California has the most number of people, the highest number of people 65 and up. It's got the biggest elderly population. If you call that, I think 65 is still young, personally. I don't think that's old. But if you use that as a line to elderly or not, California is number 1, Florida number 2, Texas number 3, New York number 4, and so on and so on. Pennsylvania number 5. So there is a very strong correlation, it seems to me, with a few outliers between the number of deaths a state has experienced and their population of 65 and over individuals. I'm just saying, you look at it, most of the red is up here, and I did color code it. We've got a few outliers, like Virginia's kind of down here, but you know, this is mostly trending red, right? And look down here at the lowest death states, right? Those are all green. That's like, you know, it's all green. By the way, they go to 51 because of DC. You know, DC, I didn't have a ranking for a population of 65 and up, so that only goes to 50. But you can see it's like green at the bottom, red at the top, a couple of outliers. So those would be like New Jersey. Okay, New Jersey, we know had kind of a nursing home problem. We know there are a lot of deaths in New York, New Jersey, in elderly people, right? Because there were some problems specifically in nursing homes. Massachusetts also is one of those outliers. I really don't know why, but it was still number 15 in terms of 65 and up. But basically, there is some sort of correlation to the amount, the number of 65 and over population, it would seem, and especially if you take into account density or how close they might live together. Now, that said, let's look over here at column C. We actually have from CDC, this data is from CDC, the number of COVID-related deaths by age group. Not shown here, we not only have the number of COVID-related deaths by age group, we also have it broken down by category of different kinds of codings of the death, and I haven't quite cracked that one yet. So that would be if I were to try to pull out the underlying medical conditions impact, and I haven't quite cracked the code on that one yet. So just know that it's there, but that's not counted here. What we have is we know by each segment of the population by age per state, how many people in that age group died for COVID-related conditions in that state. We have those numbers. It's straight from CDC. Again, we didn't have most of this data in March, right? So when people are bashing, I'm sorry, this is not trying to be partisan. When people are bashing the president for clamping down a little bit in March, we didn't have any of this data. I mean, we didn't know this. Give the poor man a break. He's our president. Sorry, little rant there. Back to the point. 80% of deaths on average, if I average them all, or 79% are in the 65 and up category. Now that's lower in some states. Texas is 70% of their deaths, 65 and up. I updated this, by the way, pretty recently, so it should be pretty accurate. And I mean the deaths by age group. Some states are high, like Massachusetts. Look, so this helps to explain why the state that is ranked 15 for population of 65 and over is number 6 on the death count. 90% are in the 65 and over population. Why? I don't know. Maybe they had a nursing home thing too. I don't know. But so that's good news if you're under 65, right? I think so. If you're over 65, it's not great news, but there's also more to it that I'm not going into here with underlying health conditions and stuff like that to account for. There's still good news even for that age category. Now, if we look at 55 and over, on average, 92% of all the deaths are in 55 and up. And again, this is just raw average down the column. I didn't weight this by population. So it could be a lot higher than 92. It could be a little bit lower, but probably a lot higher because you see a lot of these big states, there's 91, 92, Texas and California, a little bit lower, 93 in Florida, 97% in Massachusetts, 55 and up, 96% in Pennsylvania. So basically, if you're under 55, your chances of dying are pretty small from this condition. If you're 45 and up, let's look at that. The raw average down the column is 97%. That means if you're under 45, you got really small chance of being killed by this thing. And it goes down and down and down as you go down by age group. Okay, but here we're only talking 3% of the deaths in the 45 and under, or under 45 age range. In some states, it's even higher, like Pennsylvania, 99% are 45 and up. 99% of deaths. So this data, what I want you to understand is that this data is all out there. Now, I had to do the data munging to get this chart, right? But the underlying data is there. You could get it too. And there are actually some charts out there now where you can kind of get an idea of what's going on with each age range, just from CDC and maybe worldometer. I can't remember. I'm going to show you some of those. Questions? I wish I had live people here who could ask questions. Don't you? I'm sorry. I need a bite to eat. If you're eating something, go ahead and eat, because my mouth is dry. I'm going to take a bite to eat and get a little drink. All right. We've looked really hard at some data that's focused on case count and deaths. However, we can't form an accurate rate without trying to estimate how many people have really had it, because we have not tested everybody. I know people who've almost certainly had it because their spouses had it and they never got tested, right? You know, but they came down with symptoms after their spouse or whatever. Probably, you know, they had it, never got tested. There's a lot of those people out there. There's a lot of people walking around asymptomatic, as that one article we looked at earlier showed. 40% of the 65 and up population in those nursing homes they sampled, no symptoms at all. So how do we get a hold of that? How do we get a feeling for that? Unfortunately, I will tell you, well, the good news is there are some studies. The concerning, a little bit concerning news is that they've not been updated, as far as I can tell. So we'll go with what we have. So CDC's latest study of this, they've got 3 or 4 studies that they've done or partnered with others on. The one I used is the Nationwide Commercial Laboratories Seroprevalence Survey. Its data came in no later than August 15th. So it was basically, I think they took about a week's worth of data, July and August, from various different random parts of the country in every state. But some states were so low that their sample size was so low, you have to throw out the results. They're just worthless. CDC even says, you know, that the numbers that they did come up with for the states that had low sample sizes are probably underestimated. So what you're looking at is a graph by estimated, this is August, remember, this is August, I believe, estimated percentage of this population of each state that has already had it, that has already been exposed. Again, I say this is an estimate of the percentage of populations already had it in each state. The highest was New York. New Jersey was high too. I don't remember New York, but they estimated it, you know, up to 10 times or more, probably at least 10 times as many people who were confirmed cases in New York had actually been exposed and had this thing, because they had the antibodies showed that there were that many people walking around with antibodies in their system. Okay, this is CDC data. I'm not making this up. And you can see, like, on this scale, New York's pink. So in a lot of these states, there was already, this is August, there was already pretty high exposure. Like Texas is a huge state, right? Look, it's somewhere down here. I don't know what that is. I don't have the data in front of me, but let's say it's 8 or 9%, something like that. It's pretty good. And that was in August. And here we are a few months down the road. So how many must there be now? I'm telling you this because you need to know that we can't only look at the number of confirmed cases. When you're talking about herd immunity and such, you have to try to estimate the people we don't know about, that have already had it and are fine, right? That never got tested for whatever reason. And sometimes people are tested only because they know they had an exposure to somebody who had it, and so they go get tested, but they never have symptoms. So what I did is I weighted most of that data. I excluded some of, I think I excluded some of the really, really tiny population samples that were said to be unreliable. But I weighted by population the data, the multiplication factor, let's say, that CDC had for that state. So for New York, it was 10, right? For another state, it might be three times as many people who have been exposed have probably had it. Another state might be 2, another state might be 7. I weighted by population and then averaged to make a weighted average, basically. That weighted average was 3.78. So that's a very conservative number based on this August study, very conservative estimate of how many people, compared to the number of confirmed cases we have now, how many people have already been exposed. So when I put this data together, it was 8.6 million people and some change. Multiply that by 3.78. That yields 32 million infections in the US, almost 33 million. That's higher now. And again, that's conservative. CDC even says it is likely higher in many of those states, right? So that's conservative. This is good news. This is really good news. I hope this encourages you, because the news media is making us think everybody's dying, everybody's getting it, everybody's getting it. A lot of people have already gotten it and had it and are done. They're done with it. And when you talk about herd immunity, if our goal is we had to get to about 67% of the population, I don't know the actual number. That's what I hear. What is that? I don't even remember. How many people do we have in America? I'm blank. I want to say it's like 340 million, but I may be wrong. I should have looked that up again before I've got it in my data. I just don't want to go flip to it. But let's say it's 340 million. That means we have to get to about 180 or so million people, 170, 180 million people to reach 2/3 of the population. Well, if we were at 33 million then, we're at 9 million cases now, so we would be up to, I don't know, close to 35, 36 million now. We're well on our way. And this could be low. It could be 50 million people walking around have already had this thing and have antibodies to it. God gave us immune systems. That's how it should work in our bodies. Is that we get exposed, we don't get sick. It doesn't have a right to us, and our bodies shut it down because God gave us the immunity to fight it. Okay, going off on a tangent. Know that this is out there. There is a website. In fact, I will just briefly switch over to the website and show you one of these. Oh, go away, Zoom console. Okay, maybe it's this one. Oh. Not this one. It's this one. Okay, good. Here it is. So, like, it's right here. You can go to this. I didn't pay for this. I don't have to be anybody's secret to get to this. You can go and access the same study. You can download the data for yourself. It's all right there. Test what I'm telling you. Don't just believe it. Test it. Okay. Put it to the test. Now, let's very quickly, because it's already been a long time, go through some charts. Now, these are pulled from worldometer. And I want to show you back on the worldometer site, if you scroll down, I'll make this a little smaller here, or not. If you scroll down, once you get below that data table, you start getting into the charts. So they've already got charts there. All right, we're going to look at a few of them. So this is daily new cases. This is the actual number of cases worldometer recorded for that day. So when you hear the news media saying yesterday, this record number, this spike or whatever, throw it away. Yeah, numbers change. I mean, it's an imperfect system to begin with, the technology and reporting. They do batch jobs, there's all sorts of stuff, right? So, you know, you're going to see numbers just because of the technology going up and going down and going up and going down. You can't expect it's all working perfectly. And it's also nature. We don't control when somebody chooses to go get tested, right? We don't control when somebody feels sick enough to go get tested, or when somebody finds out that they have it, but they've been around 30 people instead of 3, and then those 30 people all go get tested at the same time. We don't control that, right? So, like, throw out those dumb articles, and forgive me, Lord, a little too opinionated. Those non-helpful articles that start throwing around these daily case counts in there as being something you need to worry about. Forget about it, because like, this is worldometer. See, they even have a little checkbox you can check and get a 3-day moving average. That's far more helpful, because you can't look at it day by day. It's like my weight. I have an electronic scale. I see my weight go up 5 or more pounds in a day, and I've seen it go 5 or more pounds down a day, and I've seen it change nothing in a day, and I've seen it go up or down a half a pound in a day. I don't know why. Well, salt is largely the big increases. I know that, but you know, you got to look at it that way. I can't look at my current daily weight as being the for sure end all verdict. I have to look at the trend over time. So there's a 3-day average. You see that March 2nd, that was 12 down here, starts peaking up at the end of March. And then it actually, this is the number of new cases per day. Remember, we didn't have the ability to do testing as widely at that time. So, so there's not that many tests being administered. So not that many confirmed cases, although plenty of people may have been getting exposed. They just weren't getting tested because they had no symptoms. And then we see it dip down a little bit into June, and then goes way, way, way up. Well, now we have a much greater testing capacity. President Trump even talks about this, right? Yeah, our numbers are up because we're testing more people. That's true. That's true. Yeah, I mean, these are people who may have been getting sick before, but we're never testing them, but now we can test them. So the tests go up and then they go down, and yeah, it's up again. There's more people testing positive toward the end of October. Is that something we need to worry about? Not necessarily, right? Let's look at the 7-day moving average. So these charts all have a 7-day moving average too. So you can see when you overlay the 7-day moving average, it smooths things out. See, this is much more helpful than a day-by-day trend or a day-by-day change. And we get that first little peak, which was testing constrained for sure, and then a second little peak, and now we're up on another incline. But is that necessarily any reason to worry? Well, do we have more sick people or more people dying? You know, those are questions we should be asking. They also have these charts, which you can look at. It just plots the total number of coronavirus cases on a linear scale. We've already seen this. You know, I showed you that from June to October on my chart. And then they have it on a logarithmic scale if you prefer that. That's still like, I never really learned how or when to apply these logarithmic scale things. I understand logarithms, but kind of. But anyways, if you find it useful, it's there. Now, this is what people care more about is daily new deaths, right? And again, we can't just look at a day-by-day basis. So I think CDC, if I remember correctly, I could be wrong, check it. I think they say they update their numbers only like Monday through Friday, you know, that because they don't work the weekend or something. So these numbers aren't necessarily real time. And if they're not updated on the weekend, Could you have a lot of cases that rush in on Monday that actually came in over the weekend? Maybe. I don't know how they're tagging data in their systems and stuff. So expect spikes. But let's look at these 3-day average. Well, in fact, you can see it. Let's actually test that. You can see it every week. Spike, dip, spike, dip, spike, dip, spike, dip. You can see it. It's going on right here. So the media outlet that says, oh, from this point, see where my cursor is, right? From this point to this point, there was this big increase. Yeah, but some of those cases probably landed here, which will level out the numbers a little bit. We can't fill our minds with that junk. We need to be informed. Okay, the 3-day moving average, again, not so useful because we're still seeing that kind of spiky behavior. The 7 days far more useful. So look at the trend over 7 days, and what we see is when we had only a small testing hump. Remember that from the slide before, or 2 slides ago, only small testing hump. We had a huge hump in the daily deaths. Okay, so then it goes down, it goes up just a little bit here in July, August, then it goes down, and it's been trending pretty consistently since then, pretty flat. So cases have been going like this, right? But deaths seem to be more flat in terms of the actual number of people dying. This isn't a rate, this is the number of people dying, and or whose deaths are labeled COVID. That's another distinction to make, but let's say they are COVID. Now, where I have the cursor here on the worldometer chart, you can just do this. You move the cursor around it, it'll tell you the day and the number. April 2nd, that point right there was 864 people average per day recorded dying. Now that was on the upward trend there at that point. You can see where we are here. We're a little bit below that. So according to the 7-day moving average, our average has been more like, I forget the actual number, I want to say like 818 or 840, something like that. But we're sitting actually a little bit below that April number, and we've been trending below it pretty flat here. So as number of people testing positive is going up, the number of people dying isn't necessarily going up. That's good news. That's good news. Because if it was a linear correlation, then as more people got tested positive, more people should die. But we don't see that happening. That's good news. That's good news. All right. So you need to be armed with that information, and here's where you can go get it. If you hear, oh, it's a big spike, it's yada, 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 go here, go to CDC, wherever, and look, what is that moving average of daily deaths? Is it actually going up, even though cases are going up? I don't really care if cases are going up, personally. I don't care. If people aren't getting sick by it, what does it matter? Sorry, I'm a little opinionated. I've been tracking this for a while. That's why I'm sharing it with you. All right. It's been a while. You still with me? Thank you for hanging in there. If you had to pause and come back, I totally get it. So just charted it again. We looked at this on my chart that I did without the earlier data, but this is a number of deaths. It is pretty linear. Of course, it spiked up earlier in the year pretty consistently, and then it had a little dip, and now it's been a pretty steady slope there, although it looks like it's curving downward a little bit there. We'll see. Logarithmic scale, if you care about that. Now let's put these charts side by side. Okay, so we've got new cases on the left, and we've got new daily deaths on the right. New cases, both with 7-day moving averages, so that you can see the more proper trends. We see daily new cases here, a little hump in new cases. Again, I think we were just testing constrained there. Daily new deaths, way higher. I don't know how to explain this. The whole thing that the hospitals didn't necessarily know how to treat it. Maybe we probably got some new medicines and therapies that help. Personally, this is my opinion. I'm not going to do this too much in this presentation. I think there's something spiritual behind that. I'll save that for my other episode that I intend to do for followers of Jesus and how to look at this. But I think there's something spiritual behind that. But you can see that that first hump of daily deaths was way out of proportion to what the new cases was. And then daily deaths goes down and then goes up a little bit. You can see there was that second hump of new cases. It looks like that peak occurred right around July-ish, late July. Looks like this daily new deaths occurred maybe a week or so after that, you know, around first week of August, something like that. But it wasn't the same as this first spike. I mean, there's a very, very big difference in the number of deaths per day compared to that first spike. And ever since then, it's had a little, you know, momentary fluctuations here or there. You might get it in a nursing home or something, but it's been fairly even, maybe ticking up just a little bit, but it's still sitting below the April 2nd number of 864. As of this date was October 25th, I think, when I pulled this. Excuse me. All right, so that's good news. I mean, this is the kind of thing you've got to do, right? Because you're not getting this from the media. You're not getting the media saying, yeah, well, you know, there was deaths went up a little bit, but it's nowhere near where it was in March. And the number of cases has skyrocketed. That's good news. That means there's less reason to worry than there was before. So CDC also has some very good charts. If I can easily get to it, and Zoom's controls don't interfere, I'll go there and show you. Yeah, so it's this page called COVID View, and it's pretty cool. You can actually download a PDF, a weekly PDF summary that they do. And it's got all these charts on there. So you can actually download data from many of the charts as well. So that's what we're going to look at next, CDC's charts. Hospitalization. Let's look at that. So this chart has quite a lot of data on it. Okay, let's start with the green line. Okay, the green line, the big one, is the percentage of deaths due to PIC. I believe that means pneumonia, influenza, coronavirus-like symptoms. I'm pretty sure that's what the C means before. I think the C was added this year because of coronavirus. Could be wrong though. I should have gone back and checked that, but I forgot. But anyways, deaths due to PIC, coronavirus gets lumped in to that category of PIC. Those deaths do. You can see this is, CDC does their numbers by week, okay? So when reading the bottom scale, you see 2020, 10, 2020, 11, 2020, 12. That means week 10 of 2020, week 11, week 12. So week 10 would have been roughly the second week of March, I think, somewhere in there, second or third week of March. So you can see that there was a large spike in the percentage of deaths, and I'm guessing this is percentage of all deaths recorded in that time due to PIC, which means pneumonia, influenza, or coronavirus. So it doesn't specifically mean coronavirus. Could have been pneumonia or influenza too, I believe. If I understand that correctly, it just has to fall in that PIC category. Then we get a drop So you're always going to have some of these deaths. I mean, because people have pneumonia all year. Influenza is fairly seasonal, but you're probably always going to have some sort of line here because of at least the pneumonia stuff. And then it goes down, and then we see in week 30 or so another spike. I'm guessing that's probably the July spike, but nowhere near the big one. So, you know, these spikes probably are legitimately trending with the coronavirus surges. Now, that's not to say these people died exclusively because of coronavirus. They might have had underlying conditions that worsened or actually took them when they were battling it. Anyways, it trends down, and then this is very interesting. So look, the last 2 weeks is like shot way down. Now, CDC does have something on their website that says that these numbers may change as new death reports come in. So I guess maybe there are some ways in which death certificates and codings and stuff take a while to go through the system. And so these numbers could change. It could actually smooth out or, you know, be a different slope based on what comes in, I guess. We'll have to check in another week or 2 or 3. The data's right there on the CDC website. COVID View, I showed you where to get it, and you can see. But the trend has been downward on percentage of deaths due to PIC, pneumonia, influenza, and I think coronavirus. Now, some of these other lines, CLI, I'm guessing that is coronavirus-like illness. I'm guessing that's what that means. I wish I'd looked that up, but no worries, you can look it up. Anyways, we see it doesn't quite match the lines of green. You know what? It's bothering me. Let's look this up real quick. Let's look it up. CLI definition, CDC. Oh, well, that's not it. Maybe this. It's not command line interface. I know that. Well, maybe it's on COVID View. Let's see if we can figure this out real quick. See, they use this terminology, but you know, they explain it somewhere. COVID-like illness. It is COVID-like illness, and ILI is influenza-like illness. That's what I thought. So this is curious. I don't know how to explain this, except that maybe the deaths lag the actual recording of the illness a little bit. So you see coronavirus-like illness. So this presumably should trend to COVID. The hump precedes the death hump a little bit. Okay, but it's not the same magnitude, which is a little bit of a head scratcher. But you can see that this red line kind of trends a little bit ahead, a week or 2 ahead of the green line. And that seems to be pretty consistent, except that in the past 2 weeks, it's flatter. So we'll see. I haven't really thought much about that. But the important thing is for you to learn how to read this trending. Now, the percent positive, we don't really need to spend a lot of time on that. That's just going to be the of all the tests that were done, what percentage tested yes for coronavirus. You can see those were high initially because we were testing mostly people who were suspect, who were showing symptoms. Now we're testing a lot more people who were just around people who were found to test positive. And so you can see it dips and it comes up a little bit. It's really not important there to lean into. But influenza-like illness, you will want to watch this line. So this yellow line, we are entering the next flu season now, right? So we are going to see more hospitalizations probably and more deaths, because just so you know, friend of mine's internal medicine doctor, we were having a good debate on this, right? And I said, hey, okay, so some of these people with underlying conditions, if they had not gotten COVID, but they had gotten full-blown influenza, like influenza A, influenza B, full-blown influenza, might they have died then too? I said, yeah. So some of these people, you know, could have died even just by getting influenza. So we're entering flu season. We need to watch that number and keep in mind that people with underlying medical conditions, influenza does kill people, and it actually kills people. We'll see later in a younger age category too. But people with those underlying conditions could also be impacted by influenza. Now let's get to the hospitalization rate. That's why we're here in the first place. So this gray line is kind of hard to see, kind of buried in there, but this is the rate of hospitalization. So the big thing we're hearing in media right now, oh, cases are up. Another 80 deaths in Europe out of 18,000 cases. Cases and deaths and hospitalizations, okay? You're hearing like, oh, hospitals are being overwhelmed. They don't have enough beds. They're gonna have to send patients to other states. Maybe, I don't know. Find people who are friends in the medical community and ask them what they're hearing, if they're doctors or nurses or techs or whatever work in hospitals. How are they handling it? All I can say is we've got some data to look at to test that, and we'll do that. I can't give you an accurate verdict. Maybe it varies by locality, but we're well into this thing. And if hospitals aren't handling it and they're overwhelmed, I'd be a little bit surprised, especially given the data. So this hospitalization rate, look at this. So it was right up here at 10% there for quite a while through week 18 or so, and then it starts trending down. Then it goes back up a little bit to maybe 8% in week 28, 29, and then it goes way down, and we see maybe it's going up a little bit there too. It's really kind of hard to tell, but the good news is we've got more other views of hospitalization we'll look at to get a fuller picture. So is hospitalization rate going up? It appears here maybe, because assuming these downward dips get adjusted up a little bit, maybe, but how much, it's really hard to say. Now, this is hospitalization rates by age group. This is super interesting. So if we look at these weeks, and this will be really interesting to look at during flu season too, right? Because that'll just mix in with all this. We can see very clearly this blue line here, this is 65 and up. We see those same humps and those same trends in most of these age populations until we get, so blue 65 and up, green 50 to 64, black is overall, the average. But when we get down to 18 to 49 population, we actually don't see them tracking to the same humps until later in the year, when we're probably doing more. What probably happened here is these people weren't showing any symptoms, so they never got tested. So there were fewer of them. But later in the year, we're testing more people, I'm guessing. So we're discovering more people who may be in the hospital for other reasons in that age bracket, you know, have it in their body or whatever. And so it's tracking more in line with those curves. But then we get down to 0 to 4-year-olds, this blue line, and the 5 to 17-year-olds. It's like nothing. Like these folks, that young population, you know, 0 to 17, hardly anything to worry about. Even in the 18 to 49-year-old category, very little to worry about. I mean, they're at the bottom of the hospitalization bracket here. So all this to show you, we have some data for hospitalization. We'll go through some more. Hey, I'm recording this at a later date, actually the next day after I recorded the original version, and I discovered something I want to share with you. So I'm going to insert it here now because it's relevant to hospitalizations. So I was testing the theory, are hospitalizations in Texas just going rampant? Because I've seen some headlines around that. And I don't know. I don't know if there's a single number for Texas, and I'm not going to spend that much time looking into it, to be honest. But I ran across a very useful website. Let me share that with you now. So this is Texas Medical Center's website, and they have a coronavirus updates, page here. You can just go to. It's right here. And at the top here, you see we're looking from September 29th through October 28th. So a month of data with a helpful 7-day red trend line. What I want to point out is you can't really tell, you can't really test that claim. Are the hospitalizations surging in Texas right now because it's only a month of data? Yeah, it looks like from that their number of cases has gone up a little bit, but not that significantly, but maybe a slight upward trend. What we need to do is look down below, which is defining what we're seeing up on the top of the chart. And we see back in June and July, wow, they were up at like 300, 350 at this hospital, according to this data. And this says TMC Institutional Clinic Census is the source. So I'm just believing the data they're providing. They were like what appears to be 3 times worse off in June and July. And any upward trend we're looking at now isn't the kind of slope we see here, that's for sure. So is there a basis, just looking at this one medical center? There's lots of medical centers in Texas, right? So, one snippet from Texas saying, is this one overwhelmed? It doesn't look like it. If they could handle this stuff back in June, July, they ought to be able to handle what they're getting now. So just showing you that you can just go search for your own state. You hear these claims, do some searches, see what you find. You might find some really interesting stuff. So is there an overall number for Texas? I would like to find that. I don't know. I'm not going to invest the time in looking, honestly, for hospitalizations for Texas or other states, unless I feel so led. But you can do that. And I just want to encourage you to do that. Now let's get back to the regular programming that we were on track for before. So CDC actually has outpatient and emergency department visits as well on here for influenza-like illness and COVID-like illness. So this one is interesting because this one goes back into 2019. So we see here last year's flu season. That's important. So the green and blue lines are last year's flu season. But look at this, CLI, this orange line, well, it's called COVID-19 because it was discovered first in 2019. As far as we know, it didn't really exist. It came from a lab in China, it seems. It didn't really exist before then. Yet there were cases in that category earlier in 2019. So either that same virus was floating around in the wild and we didn't know it and somehow not infecting a lot of people, or there are other causes that look like COVID-like illness that get recorded in that category. I'm just saying, remember that, okay? And that line looks to be somewhere between 1% and 2% most of the time. Now, what we see is a spike, which was, when the whole coronavirus thing hit, it was on the tail end of the influenza season. So we see those stats coming down, and then we come off that spike. We get another little spike there off that one, And now here we are. Where are we going up? Are we leveling off? Not real sure, but we're nowhere near where we were here, and we're nowhere near where we were here back in June, July, late July and August. So remember that. Like when you're hearing the media, we're nowhere near where we were. This is CDC data. Nowhere near where we were in July and August. That's good news. All right, let's look at percentage of visits for influenza-like illness by age category. So this is really interesting because you can see here in the they've marked out the official 2019 to 20 flu season. So, you know, obviously we get some before and some after, but there's like official start and end dates. We've got this orange line is like the highest. Well, who are they? 0 to 4-year-olds. So these aren't hospitalizations, these are outpatient visits. But 0 to 4-year-olds had the highest reason to go into the doctor. Maybe it's just worried mommies and daddies. Could be, I don't know. That was interesting to me. This gray line is 5 to 24-year-olds. They're second in line. They had the second highest reason to go in to the doctor. And they got tested and it was recorded as an influenza-like illness. So influenza maybe is largely affecting younger people more than older people. The next line is 25 to 49 years old. The next line, 50 to 64, and then the green line, 65 and up. So the older people are at the bottom of the list here for outpatient visits. Now, it's possible that as you get older, you're more likely to end up in the hospital versus outpatient. I don't know. That seems unlikely because, you know, it just seems unlikely. Maybe a little bit of that could be true. But it's very interesting. It's almost like this is the inverse in terms of effect on age, as far as we can see by who's showing up to the doctor, as coronavirus. Coronavirus largely affecting the older you get, the more likely you are to be more seriously impacted. Influenza, or ILI, influenza-like illness, the younger you are, the more likely you're to be impacted, such that you go to the doctor, it would seem. Interesting though. Keep that in mind because the next flu season's really upon us. Now this is super interesting. I hope you're still with me, because when I saw this, I was like, wow, there's a lot of data on this chart. So let's start first with the yellows. Okay, so we see 4 influenza seasons on here: 2017, 2018, 2019, and 2020. We see that 2018 was a worse influenza season, worse than normal. We also see that the lines here, the top line represents the epidemic threshold, I guess. We also see that the spike of percentage of deaths due to PIC, pneumonia, influenza, coronavirus, so same category. Now keep in mind, coronavirus, as far as we know, the COVID-19, SARS-2, did not exist back then, as far as we know, right? So it wasn't that. This was influenza, most likely. But the percentage of deaths spiked well above the epidemic threshold. If the epidemic threshold is right around 6 something there, maybe 7, it's almost double that. It looks like 11 or 12. So well above the epidemic threshold. And then here we get into 2020, we see the influenza season, more normal this past year. And as it tapers down, coronavirus spikes up, and we go way, way, way up to 28% of all deaths coded due to PIC. In that case, again, that doesn't necessarily mean COVID-19. The COVID-19 deaths are shaded in blue in terms of how the death certificates are recorded, I guess. But the percentage of deaths due to PIC is a red line. And so where those white gap may be influenza or other things, right? Pneumonia. But you can see a huge spike there initially, and that went up to, I don't know, it's hard to tell, 28 or something like that. Number of deaths over here on the right is close to 18,000. And then dropped significantly within 15 weeks or so, 10 to 15 weeks, and dropped down to about 7. And look at this. If we just draw the line over here, drop down to about the point where the height of the 2018 flu season was in terms of PIC deaths. Then it spiked back up again, and then it dropped way, way, way down. So this is where we are right now. Now, even if you take 2 weeks out of that, and you say we're actually right here and we just don't know it yet because we haven't gotten some of the deaths in. Like, draw a line over to the left here, keeping it as straight as I can. We're probably right about there where the pointer is on the 2018 PIC percent of deaths chart right now, or lower. So I'm pointing this out because in 2018, we didn't close our country down for influenza. In 2018, we didn't mandate everybody start wearing masks and keep wearing masks. In 2018, we didn't tell restaurants they couldn't seat people next to one another for fear they might get influenza. In 2018, we did not shut down whole school systems. Maybe there were schools shut down for a day or two or a week if there was a bad outbreak at a school, but we didn't shut down entire school systems because of influenza. Yet right now, we are sitting below where the percent of deaths due to PIC was in 2018 in the influenza season, which was above epidemic threshold. I'm just saying, you need to know this. You need to wrestle with this. You need to think about it. Yes, did we have a big spike at first? Yeah, we did. Yeah, we had a second decent sized spike. The second one was maybe double, maybe another. So this is five above epidemic threshold, maybe another 5 above that, 6 above that. So maybe a little bit twice as high above the epidemic threshold is this 2018 flu season. But right now, we're not even sitting there. And so when it comes to long-term policy and how we treat this thing, we just need to be informed. We need to know, like, this is what the data shows you. You make what you want of it. My job is just to help you get there and to know where it is. This is available. It's updated weekly, I believe, on the CDC website. I think it's part of that PDF you can download, or you can just go to the webpage, a COVID view, but it's right there. We have to keep looking at this data and asking the hard questions. The other thing I want to point out here is look at the blue surface area, COVID-19 coded deaths. So this has come way down. In fact, currently, even if you backed off, right now it's like 0 because there's a lag. But even if there's a 2-week lag, let's say there's a 2-week lag, even if you back off, we're below epidemic threshold right now. Like, if that's 2 weeks ago where the cursor is, we're below the epidemic threshold for COVID-19 coded deaths. So if it's not COVID-19 and it's in the white, what is it? I don't know, but it's not COVID-19. Why are we making it about COVID-19? I don't know. I'm just saying, maybe there's flaws in the studies, flaws in the data, but there's very clearly some other illness out here doing something, and maybe I'm just getting it wrong. Maybe it's just a difference of scale. I don't know, but certainly when we look at where we are, if we just back up 2 weeks, we're like right here. And if the epidemic threshold is up here, we're below it. I don't know. Okay, so here's the deal. This morning, I woke up and I had a little bit of conviction that I needed to look into some data from one of the slides or one of the graphs I discussed in the presentation yesterday. So what you just saw, I'm inserting this here because I'm in the next day right now. We're recording this. I woke up and I realized, that graph we just discussed, I really felt I needed a better grasp of how the CDC is defining that epidemic threshold and that blue COVID coded area of deaths versus PIC and how that fits with the epidemic threshold. So let me share with you what I learned, and I'm going to actually retract a statement too. I am not afraid to say I was wrong. I was tired at that point, but I'm going to retract one of the statements I made. Let's look at that real quick. I'm going to share my screen out. Okay, so this is the slide that I was discussing. Let me get the video back on so we're consistent. Okay. Remember, we were just talking about this, and what I want to do is get the laser pointer back. It's really this blue shaded area here that I was pondering in relative to the concept of being above or below epidemic threshold and the red line. So I went and did some research, and I believe a chart like this is confusing because you have two scales, right? On the left, you have a scale that's a percentage of deaths, and then on the right, you have a scale that is an actual number of deaths. So very different scales. On the left is percentage, and that's where I believe epidemic threshold is defined. I don't think it's defined at all by the actual number. From what I was able to ascertain, it was kind of hard to tell exactly how CDC defines it. But I think it's the rate, and they're looking at maybe some averages over a long period of time. I didn't dig that deep. But what they base it off of is a seasonal baseline. So that's the first black line here, the lower black line. And an article I found, which I'll share with you in a minute, interestingly says that the epidemic threshold is defined by CDC is, I think it's 1.65 standard deviations above that seasonal baseline. So that explains why these two lines always track together. The epidemic threshold is higher, and I'm pretty sure that the threshold is based off the rate rather than the raw number of deaths. Now, if I'm wrong, please send me data, correct that. That's okay. I'm not afraid to admit I'm wrong. So when I claimed yesterday, and what you just watched said, okay, if we were right here, let's say on the blue shaded line, we would be below epidemic threshold. I don't think that's a fair statement because there are two different scales. If the epidemic threshold is tracking to the percentage over here, what we see in the shaded area really doesn't have anything to do with a percentage. It's showing a raw number, okay? And that number is on a completely different scale, which could help explain some of the white area here. I still think that this white area does account for, should account for other things, but you really can't equate these two because they are different scales. They will track together because they follow a pattern, but they're different scales. Now, another thing I was noticing just today is that look look at the summer months of past years and the seasonal baseline for pick deaths. So that's like right here, and then the actual number of or percentage of deaths attributed to pick. They're significant even in the summer months. So they don't go to zero. You know, these pick deaths don't go away in the summer. And if it's not influenza and COVID wasn't around in 2017, what was it? Pneumonia, other forms of illness that look like maybe influenza, but not influenza, or maybe some influenza that stuck around, you know, but it's just not nearly as prevalent. I don't know, but it doesn't go away in the summer. Now, the other factor that can change this percentage shown as a red line is the total number of deaths. So if the total number of deaths goes down and you also have a corresponding decrease in, say, influenza deaths, you could end up with the same percentage, even though both numbers have shrank. You don't really need to understand that. I'm just pointing that out to say that there's many factors that can influence this percentage. But CDC, I believe, in terms of their epidemic threshold, is looking for a percentage. So there's assumption that the, you know, quote, normal death rate or attrition rate of people in the country, it has some sort of pattern. You know, it'll have a spike here, a spike there, or whatever. But when you add up all the things that take people, you know, across a month or a week, that you see over time, probably a fairly steady pattern or number as a percentage of the population. So it should be fairly stable. So all that to say that in the summertime, this doesn't go away. There are still people dying, and those deaths are coded, pick related, but we see the actual influenza coded deaths basically going to zero or near zero. So we can't even see it in the summertime. Yet there's still all these, however many deaths out there that are causing this percentage to be still fairly high. I mean, when you look at the change during the influenza season of 2017, influenza caused, looks like, about a 3% increase in the percentage of pick-related deaths. You know, so it was coming from 6% to roughly 9% or so, maybe a little under 9. In 2018, it's coming from around 6%-ish up to 11. It looks like probably 11 or so percent. That was the epidemic year. It looks like the epidemic threshold, I believe, does track by percentage. So that would have been, you know, true more epidemic year with deaths above the threshold there. So I just wanted to clarify that for you, because I woke up thinking, you know, I don't want to do you a disservice. And I was kind of tired and not really processing this blue bar very well, or blue shaded area, and wanted to really understand the epidemic threshold more. So I don't think we can draw any conclusions about epidemic or not based on these shaded areas, yellow or blue, because they're a completely different scale. So the epidemic status is defined based on the percentage, the red line here and the black lines, as far as I can tell. Now, the last thing I want to point out here on this chart is look at this overlap starting about week 12 or so of 2020. So you've got an ongoing flu season with, you know, some number of deaths, and then you have and it continues going on while this COVID thing starts. So you've got overlap. Now the magnitude of the COVID thing far surpasses the magnitude of what was going on there. But you know, we do see an overlap in this shaded area. So this red line at that point is going to be attributable not only to the blue, but to the yellow, to influenza too. So not only COVID, but influenza is going to comprise this red line at that point until we get into the summer and the influenza deaths pretty much taper off. I hope that helps. I hope that clarifies that for you. I also wanted to share two other interesting things before we move on to the next slide from the original presentation. As I was doing that research, I came across some interesting articles. One is, let me first say that I did come across a USA Today article that was from July that was addressing a claim, I guess it was going on social media, that we were falling below the epidemic threshold. Well, I just showed you from this chart, this is a source where you ought to be able to go to see what CDC's stats are saying. Are we about to fall below epidemic threshold or not? Okay. Right now, the red line is not at the epidemic threshold. It's still above it. You know, and that may get adjusted up as more coded deaths come in or coding gets changed. So we're not falling below right now. And we are going into a flu season, and that's going to affect that red line too. But I gotta give kudos to USA Today. A lot of their articles or headlines I don't agree with, but they seem to do an okay job of treating this discussion here and acknowledging that there was a decrease happening in mortality rate, talking about the lag, and then there is a lag in the way that deaths are coded, and data comes in for a number of deaths, and finding out people have COVID. You know, it takes a while for them to, if they're going to actually pass sometimes, and for that information to get through. But also down here, they also had these fact-checked resources, and they point to exactly what I'm showing you. That chart is in COVID View Weekly, right? And they have a link to it here, and Principles of Epidemiology. So some helpful things. So kudos to USA Today for that article. I still have an issue with a lot of the headlines I see coming across that make it seem like they're kind of fear-based. This one did a fair treatment, I feel like, of discussing that topic at hand. I would love to see USA Today do more of that balanced, fair stuff. That was great find. Now, that period they're discussing, I believe, would be about this dip right here. You see that, and you can see where the percentage of deaths is coming down, but it's not anywhere near the epidemic threshold still. It is about where the 2018 flu season was. But then you see the number of deaths overlaid on this chart meeting that line, and that's where there are different scales. And if the epidemic threshold is indeed based on the percentage of deaths and not the actual number, then it wouldn't be fair to say that this is at the epidemic threshold and likely dropping below. So I can see that. Now, this second resource I want to share with you was a very interesting article I just came across out of St. Louis University. It's posted on the CDC website, and it was here. I read some interesting stats. They say annually up to 95,000 persons might die from pneumonia and influenza in the US alone. So that's a very interesting number you and I should all be aware of. We're talking about deaths. We have to ask how many people normally max in a bad flu season, how many people might die. And this number is saying up to 95,000 people in a year might die coded as PNI. I don't know if that's in the worst flu seasons or an average or what, but that's still a high number. Right now with COVID coded deaths, we are sitting at, roughly a little over 2, maybe approaching 2.5 times that number in the US. So definitely it is a higher number than that pneumonia influenza number, but pneumonia influenza does kill quite a lot of people every year. And the other thing I noticed in terms of statistics, this is where 1.645 standard deviations. This is where I was reading about the threshold, and it says it's defined at a pneumonia and influenza death rate. So that wouldn't be a raw number of deaths. That would be a rate, or a percentage, I guess, above the seasonal baseline mortality. Okay, so that seems to be how they track it, which would, to me, indicate it does correlate to the left-hand scale, which was a percentage of pig deaths. And finally, I wanted to show you this interesting figure. So in their article, now their article only, it was published like now, it's a November issue of this publication, but it was looking at this data. So I don't think their article is covering between here and here. I think they said it went through week 24, which is probably right there. And all this discussion was going on about epidemic. Are we going below an epidemic threshold or not? So they did, they weren't really addressing it, I don't think, intentionally from a COVID perspective, but it looks like they're looking for different ways to define what is an epidemic in terms of influenza. But I did find this interesting to see that, I guess the top chart here, A, is their proposed different method of looking at outliers. And I'm guessing that this must include coronavirus spike here, because that is the spike we saw in 2020. The influenza year was a more normal year, but we see this big spike caused by coronavirus in that first wave. Now, they're just outlining identifiers above some, or outliers above some threshold. And I didn't read into all the methodology, but it looks like, they're just proposing a different way we look at what is epidemic or not. Here you see them using an actual, coded area above this gray line is, I think, the normal CDC epidemic threshold, and just you can compare and contrast differences, whatever. But either way, it was interesting to see this data, because they are talking about that time back in July, and so you can kind of read through it if you want. I didn't read through the whole thing. I just ran across it and thought, oh, well, that's really interesting. So there's all sorts of helpful stuff out there if we'll take the time to read into it, and we don't always have a lot of time. So just point that out to you. Now let's get back to the normal programming. I just wanted to insert this in here and give you that update while it was fresh on your mind, and say I believe I was mistaken about saying this. If we're here on the blue area, that means we're below the epidemic threshold. I don't think that's actually accurate. After I thought about it, I think we need to look at the red line for the epidemic threshold, is my understanding. Okay, back to the regular programming now. Okay, enough of that. I'm glad you're still with me. Thank God. What a trooper. This has been a long time. Oh my gosh, 2 hours. Let's wrap this up. Okay, I won't cover this. Know that there are hospitalization forecasts out there on the CDC website. What I want to point out is there's like 8 of them on here, and they all look different. Many of them share similar trends, But who really knows what's going to happen? Who really knows? You know, the thing to do is to like look at them over time and try to figure out which ones are predicting more accurately. If you're going to do that, I don't really care. But there are predictions out there for hospitalization rate. And we're hearing all this yada, yada, yada about, oh, hospitals are so worried they're going to fill up and they're going to have to ship people out of state. Well, you know, we're not there yet, so we can't tell what's going to happen in 2 weeks, but you know, we can say there are some predictions. What do they say? They may not be right. We'll see, we'll find out, but there are some predictions. And the other thing I want to point out is almost all of them, except for one, have it trending slightly up, or sometimes a little more than, like a little more slope, like the green one's a little more aggressively up. But there is this one here, the COVID-19 sim in the yellow, orange color, mustard color, that's trending down. So they're all different. That just tells me nobody really knows this yet. Nobody really mastered this yet. But we all can challenge ourselves to be informed about the actual data as it stands today and speak to it. So quickly wrapping this thing up, interpreting the data. Is the case count increasing in the US? Yes, it absolutely is. And it seems to be increasing at maybe even a higher rate, a little bit, maybe not a higher rate, but certainly a higher number every day, it would seem that currently it is increasing again. Are the PIC coded deaths increasing? That was that slide two slides ago. PIC coded deaths is a percent. Look like they're decreasing. That's the red line here. They look like they're decreasing, actually. Well, I'm just saying, they look like they're decreasing. If you look at COVID coded deaths, you know, there was another chart that made them look like they might be starting to increase again, but by number of deaths per day. But you know, the CDC chart doesn't have it turned upward yet. So maybe PIC deaths are increasing a little bit, but is the PIC death rate increasing? No. So that was this. This is a rate. The red line is a rate. That is definitely not increasing. It is definitely decreasing here. Got it? Okay, case count and death count increasing at similar rates. From the first chart I showed you, we can see that the case count and the death count are not increasing at the same rate. Case count is increasing at a much higher rate than the death count. The death count appears to actually have flattened off, but it is going up. There's 800 something people dying every day. By the way, a presidential candidate recently claimed there's 1,000 people dying every day. I'm just saying, no, it's not. It's 800 something according to the data. It's increasing, but the change in increase hasn't really, it's not really going up. So it's not like at a rising rate. But the case count is going up at a much higher rate. You know, so maybe people are getting it and not even knowing. I don't know. Are PIC hospitalization rates increasing? Not according to, well, this is mortality. Let's see, where was PIC? Well, this is COVID hospitalization rate. So maybe slightly increasing based on COVID. Okay, we don't have hospitalization rate for PIC. So maybe, I don't know. If the death rate is decreasing for PIC, I would guess a hospitalization is too. And are all ages affected equally? No, we saw that for sure. The older population is affected far more by coronavirus, it appears, based on outpatient visits, that the younger population is affected more by influenza. And what is the role of comorbidity? Now, I didn't have time to do all that research and get into it. There's a lot of other people talking about it, and CDC talks about it on their website. There's definitely a correlation between the people who get COVID and die, and they're having underlying health problems already. Okay, not just age, but age and underlying health problems as well. So younger people with underlying health problems may still be affected, but not at the same rate. The older you get, with the more problems you have, probably the more at risk you are, is how I would say I understand the data today. Do what you will with it. Correlations that I would say we've seen a correlation to age. You know, the older you are, more susceptible, and underlying medical conditions. And also the number of deaths in each state and being correlated to the size of that 65 and older population in that state. Seems to be something that's a thing, you know, unless there's another factor at play, like Massachusetts, which was, I think, 15 on the number of 65 and older population in that state, the total population, but was higher on the death count chart. But we saw that 90% of the deaths were in the 65 and up population in Massachusetts, a higher percentage. So there does seem to be a clear correlation to that. So states with higher 65 and older populations are having more deaths. Hospitalizations are likely to correlate to age. Yes, and we did see that. And underlying medical conditions, again, not going to discuss here. Seasonal flu, as I mentioned, we're getting started into the flu season here. It's going to be something interesting to watch. Don't allow media to jerk you around. I've shown you data. I've shown you where you can get it. CDC has it. I can't tell you. I can't tell which way this election is going to go necessarily. I think I know, and I hope I know, but I pray I know. But, you know, I don't know what's going to happen to media reporting and stuff after the election. All I can say is be on your guard that you're not putting into your ears things that aren't giving you a clear picture, the whole picture. If you're looking at the data and you're hearing news that is consistent with that, that's one thing. But if you're just listening to the news and you're, I like my whatever news channel, and they're always giving you this negative news and you're not challenging it, well, it's honestly, if you're walking in untruth, it's on you because the data is there. So tough questions. What is the right balance between protecting the vulnerable and protecting our economy? I have opinions. I'm not going to give them here. Ask yourself, what does it look like? We have to have an economy. We have to do business. What is the right balance between protecting those at risk and our economy as well? If we don't have an economy, you're going to see far more deaths. I mean, if we don't have an economy, like, I won't get started on it. Just think about it. If our economy tanked and we trended toward third world status, I mean, no, we can't have that. We can't have that. Is masking it or mandated masks the right approach here? I definitely have my opinions, but it's a question you need to wrestle with. And as you're voting, you all of these questions you need to align and take into account your opinion and your answer as to how you vote. I'm not going to tell you how to vote, but I am going to tell you it's your duty as my duty to kind of wrestle with this stuff and then ask how our politicians that we're voting for align to that, because we're giving them a yes when we vote for them. Now, are business restrictions the right approach? I don't know. Think about it. Could we better protect the vulnerable while also better protecting our economy? I think we could. Again, I'm not going to go into my opinion of what that would look like, but I think we could do a better job of protecting the vulnerable while also letting our economy come back faster. Let's just say that. And why haven't other epidemic level outbreaks led to what we see now? Taking into account the current data. Remember that last chart of flu data I showed you from the CDC. Very interesting. 2018, we were well above epidemic level, and we never got near the point where we are now. Yet with COVID deaths, we're back, we appear to be back below that level and below epidemic threshold. I'm just saying, you got to wrestle with this. It's a real thing. We are where we are. Is it right that we got where we are, or that we're still where we are? We got to wrestle with this, and we got to vote accordingly. Now, a personal question: are you afraid of this? Are you afraid of this? Actually, that's redundant because I'm about to ask you that again. But have you been hearing this truth? I want to ask you. If you have, great. Let me know. If you haven't, and this has been helpful, leave a comment, please, or whatever, like it, whatever, subscribe. I hope this has helped you, but have you been hearing this truth, statistical truth, kind of weighing what does the data seem to say, so that you can compare that to what you're hearing other people say from your media, from your news media of choice? Again, there are some media outlets out there that are being more fair, that are telling more of the whole story. I don't think there are many, if any, mainstream media outlets doing that. There's one I can think of that's a little bit more balanced, but even they're not totally balanced, in my opinion. But you know, I'm talking about smaller media outlets. You know, you're gonna have to look for them. And if you want help, let me know. Leave a comment and say, help me find these things, and I'll do that. Again, this isn't my job. If you want to help me do this and support me, leave me a comment. I'm not doing this for that. Put your email address or something in there. I'll try to figure out how to let you do that, because it's not my job, but I'm happy to help you. So if I can help you find these other outlets or find other people who've already done that research and point you to them, I'm happy to do that. Are you in fear of this virus? I just asked you that. It's a very important question. I will tell you, this is my opinion, and it is going to be a spiritual one. Don't fear this virus. I believe you're in less danger if you do not fear it than if you fear it. I believe that. I would say, my opinion, don't fear this virus. And are you in fear of death? Honestly, I'm not in fear of death. I'm not going to fear death at all. You know, when God wants to take me, he wants to take me. I already died. That's going into my beliefs. But I already died, and I'm alive in Christ. That's how I look at it. I'm not going to fear death. But do you fear death? Is it? And if you're answering yes to anything, it's not to shame you, but to help you see it. Because if you are, it's going to be it's kind of a chain over you. When you what you fear is what you serve. What you that's why we say fear God. Because what you fear is what you will serve. What you gaze at is what you will serve. And I don't think you probably want to serve death or this virus. So have you educated yourself on these statistics before, on the various positions that politicians are making in your local area and national level as a response, and the implications of these to our citizens? Have you educated yourself and wrestled with this? Have you wrestled with what your government, state and local, is asking you to do or mandating that you do, and how it affects you and others in your economy? I can tell you, in Oregon, where I live, I am not happy with how our state and local government has handled this into October. I'm not happy with it. I've watched businesses go under. My favorite cafe where I got this they have the best scones. that I've ever tasted, by the way. You know, where I get this, see this delicious pumpkin butterscotch scone. Where I got that, you know, those guys seem to still have a thriving business going. It's turned up now that more people are out, but they're still not letting people into the cafe to sit. So that the days of being able to meet up with a friend and sit down over coffee, it's like, it's starting to get cold and rainy out. You know, outside is not a very good option anymore. And you got to do it in your household. That's not a bad thing, but these policies are having effects on us socially and on our society. And when we vote for politicians, we're voting for what they say they're going to do. So wrestle with that. What does an appropriate response look like? And make your vote weigh your opinion rather than voting party lines. All right, very quickly before we wrap up the part one, data versus headlines. So I'm just going to give you one example, again, to hammer home the media point. So this was like 2 days ago, I think. I'm just, you know, I see this pop up on my phone. I'm like, there it is again. Okay. This is like my concluding media example. So thanks to Vox here, U.S. hospitals preparing for the worst case scenario as COVID-19 surges again. Below that, you got the Wall Street Journal saying pandemic fatigue is real and it's spreading. I'll tell you, I'm fatigued of pandemic talk, of these restrictions. I am personally, but you just heard that. So let's look at this Vox article here. U.S. hospitals are preparing for the worst case scenario as COVID-19 surges again. How does that make you feel? U.S. hospitals are preparing for the worst case scenario as COVID-19 surges again. Hospitals are making plans to ration care and move patients out of states as beds fill up. Deaths are already ticking up, with the U.S. now averaging more than 800 every day, and they usually follow the same trends as cases and hospitalizations with a slightly longer lag. Fortunately, hospitals have figured out how to better treat COVID. That is, praise God, that is good news. There's some hope there, which is leading to lower mortality rates. Yes, see, there's a little bit of truth hidden in there, right? Better COVID-19 treatment, there's lower mortality rates. If it had stopped there, it'd be great. Then it says, but still, more patients in the hospital will inevitably mean more deaths. Oh, but wait, you can't be hopeful. No, because more patients in the hospital will inevitably be more deaths. And the scary feature of this new wave is that cases and hospitalizations are climbing everywhere. In previous waves, cases were ebbing in one part of the country while they spiked somewhere else. But now the entire country is experiencing a surge at the same time. And then below, they show some data from the COVID tracking project, which, by the way, I have to thank Vox and whoever wrote this article, because I didn't know about the COVID tracking project. And they got some cutesy graphs on there. So I got to give a little credit to the Atlantic and what they've done there. I haven't really dug into everything they have, but their charts are really kind of cute. They almost look like watercolored kind of charts, you know, Crayola crayon kind of charts. So they're kind of cute. Anyways, their charts show currently hospitalized, supposedly, for all the 4 regions: North, East, Midwest, South, and West. Okay, so we're going to see these flip again later, but while we got them here, I'm just going to point out the article is saying we should be worried because there will inevitably be more deaths because there will be more patients in the hospital. And the article itself was on hospitals running out of beds, basically filling up. Let's look at the Northeast. Yeah, they had a problem back in the early days of COVID. And I remember the government having to set up maybe some temporary hospitals somewhere or whatever, bringing in a big ship or whatever. We've had 8 months since then. So I got to say, if the hospitals have not adjusted procedures and plan yet to be able to take more patients than they could have in March. Maybe not as many as the first spike had, but more than they could have in March and April, then there's a problem, right? So they probably have adjusted procedures and probably can take more patients than they could before, would be my guess. But anyways, look at the magnitude in the Northeast of that first spike. It's like 35,000. Okay, yeah, so hospitalizations are going up, but look where they are now. They're like 3,500 or 4,000. They're a tenth of that initial spike. They're like, it's at nothing. And I don't want to minimize it, but is that cause for concern in the Northeast? It doesn't look like it to me. I'm sorry. It doesn't look like it to me. Midwest. Okay, yeah, Midwest is high. It looks like it's maybe as high as the record that's shown here, or maybe slightly higher. So Midwest might be feeling a little pinch. The question is, how many beds do they have? Do these all require ICU beds? And how many beds do they have, and are they constrained in the Midwest? I don't know. But their total number is right up there around 12,000 or so. So the South had a problem. I guess they were a large part of that big spike in late July. They had a problem in July. They spiked up to like 35,000 and for longer even. The South has a lot of big cities and a lot of big hospitals too, I will say. I don't know what their capacity is, and I won't claim to. All I will say is they were at 35,000 for a while, and they're spiking up. It looks like it's spiking up again. Again, don't know if it's all ICU patients or not, and whether they even COVID patients or not. It just says regionally current hospitalized. So if you look at where they are, they're at 18,000 or so, maybe half or a little more than half of that big spike they just had. So if they handle that big spike, I hope they can handle this one, because they're not anywhere near that magnitude yet. So do we need to be really like fear mongering here? That's the scary feature of this new wave, right? And listen to that language. It's intentional. Now, and I'm not saying the author intentionally wrote it. I think there's spiritual stuff behind it, but it is intentional. It's to invoke something in you, a response. The West here, that's where I live, the West. I love the West. I love all areas of America. They're all great, by the way. So the West, this was where we were sitting at the start. We had a little spike up to, looks like about 15,000 there in that July, August timeframe. And then it dipped way down. It looks like we're sitting a little bit below where the initial spike was here. Well, I can tell you, and where I live, I don't remember a lot of like overflow of hospitals, even in that first spike. I know there was some stress. There were ICUs getting crowded. Does everyone need an ICU? I don't think so, right? So also in this wave here, like the hospitals were kind of empty because we weren't admitting people. You couldn't even get routine care and non-emergency procedures done at that time. It was crazy. It was crazy. I got stuck with a bad back, like pain for like a month because I couldn't get the care I needed, thanks to our governor's orders. Thank you, Lord, for actually leading me to someone who was open. So it wasn't that they couldn't be open. It was the way the orders affected the building that my doctor was in that meant he was closed. So anyways, all that to say, the West isn't anywhere near its worst, which was in July, August. So if it's not prepared for what it is now, I'd be a little concerned. The South isn't anywhere near where its worst was either. If it's not prepared for where where it is now, I'd be a little concerned. The Midwest, it's about at peak, or maybe even a little higher. So that area may be a little more constrained, but also it's also got quite a number of large cities and beds. Again, does everybody need ICU? I don't know. We have to challenge this. I only show you this to get you in the mindset of thinking about what you're reading and challenging it with real data. And in this case, that data is right there in the article. But we're going to go now to COVID tracking, or the COVID tracking project, and look at some of the charts. Aren't they cute? It kind of looks like hand drawn. I love it. So cute. So this was the US currently hospitalized. So it looks like peak 1 and peak 2 basically are the same number. Well, we know everybody was scrambling in peak 1 because it was new. Nobody was expecting it. In peak 2, if we were scrambling that bad, I don't remember, but if we were, then it's kind of bad that we didn't plan better, because we should have learned from the first one. And if we haven't learned from the previous 2, and we're not anywhere near that point yet, then there's a real problem. All right, let me move this thing. So this is just test cases, hospitalized, and deaths, all consistent with what we've already looked at. I just wanted to show you this, to show you, here's another source, this COVID tracking project, and their graphs are cute. I gotta say, they're cute. So you can go here and get data too. This regionally current hospitalized data is pretty cool, actually. I don't remember seeing this on CDC's website, but they probably got it somewhere. So we just looked at this data, though. That's what was in the article. So we're not going to spend a lot of time there. Now, let's end this. It's been a long time. Thanks for hanging in there. Misinformation is rampant, in my opinion. We're not getting what we should be getting from the media, and we're certainly not getting a lot of hope. We're not getting a lot of positivity from the media. We need to be hopeful. We need to be positive. We need to be respectful, loving, and considerate, and have good discussions based on data, which we now have and we didn't have in February and March. Fear mongering is a thing. I just show you an example of it. And I'm not saying the author is bad, and I'm not saying it was intentional. I do think there's a spirit behind it, and a lot of times they don't even know what they're doing. But remember, the goal is to get you to read the article, because they get paid when you do. How are they going to get you to read the article? If you're more likely to read an article that talks about hope and good things than you are to read an article that talks about bad news, and if 90%, not even 90, if 60% of Americans shifted their consumption that way, seeking good and hopeful stuff rather than bad more often, there would be incentive for the media companies to operate differently. But instead, when a fear response is invoked in you, when you allow it to be invoked, because you take the words and you believe them, when you allow it to be invoked, then it's like creating a drive in there to want to know more, because that's what fear does. It creates insecurity. I need to know more. I need to control. So I'm just pointing this out. You probably already know this, but a lot of people don't see it. And either that, or a lot of people are just choosing to do nothing about it because the media has not changed, really. I'm praying for them to change, but they haven't changed, and they need to change. I'll help them change. If this will help them do that, okay, share the message. So what we do now in this election is really critical. So we are electing the next president, and we're electing officials throughout our states and local governments. And when we give a yes to somebody, when we give our vote to them, whether they get elected or not, we're giving them our permission in a way, right? We're acknowledging that that they should have the authority to implement what they stand for. One of the challenges with modern elections is it can be hard to really discern what somebody stands for. In some of our local elections, some of the candidates provide no information. It's all political talk. It's rhetoric. It's nothing. It's nothing about the substantive issues. So we just have to do what we can to demand transparency for where candidates stand on issues, and choose not to vote on party lines, but choose to find out stances on issues and vote accordingly. If we don't do that, then we have no right to blame anyone or any elected official, because we haven't exercised our vote, with the responsibility that we should. And it's hard, it's time consuming, and sometimes you can't do it all. Sometimes you have to go to someone you trust that does research and that shares good values that you share, you share in common, and go to them and say, have you looked into this? What did you find out? Sometimes you research on your own, but research it. And ask yourself, what is your stance on the COVID response? Because you should have one. You should have an opinion, and it should be based not just on what you're hearing from media. It should be based on fact, because if your response is based on falsehood and somebody can come with data and debunk it, that's not a good thing, right? We all have the data available to us now, and we should be informed and helping others be informed. I'm not saying everyone needs to do the research, but if you're that person in your household, do the research and share it with your people in your household. Maybe they'll ask some questions. You'll be like, I don't know, it's a great question. I'll go look that up. And then we already talked about voting, about being informed. So, gosh, it's been a long time. It's been 2.5 hours, way longer than I intended, but I need to share this. So I hope you found it useful. I'll do a part 2. It'll be shorter, I think, because we'll just be looking at the presidential candidate statements, but I'll do a part 2. I'll try to get this one up at the same time, but I may just have to go ahead and post this one first. Thank you for taking the time to listen. I hope it's helpful. Leave me feedback if you will, and subscribe if you want. God bless you. Wow, thank you for taking the time to watch that with me. Thank you so much. If it was helpful to you, please click like, leave a comment. If you would like more, leave a comment, let me know that. Subscribe to the channel. This channel is not intended to be for this kind of message all the time, and in fact, I intend to use it more for releasing prophetic in the future, but I need a place to put this. So I'm willing to do more of this in the future if I can, as my time allows. This is not my job, but if you really enjoyed this and you got value out of it, and you would like to see more, and you want to just pay it forward and help support me, let me know. I don't have a way for you to do that right now, because that's not why I did it. I really don't actually have a way to do that. But if you're interested in that, let me know and I'll figure it out. Because certainly I do plan to upgrade my media equipment and do more things. But yeah, I'm going to do those anyways. But if you want to help support that because you've been blessed, great. If not, that's okay. That's not why I did it. I did this because I love you and I want you to be blessed and have truth. So may God prosper you. May God's shalom come upon you, and may God's blessing carry with you and your family now and forevermore, in Jesus' name.